things like that. So it's been a complete learning curve and a change literally on a week-to-week basis on how we do business. But it has affected us enormously from a business point of view, number one. And it's been stressful for the staff. It's a huge psychological issue to deal with over 3 months. You know, you're dealing with positive people on a daily basis and you've got to go home to your families.
At the moment, the reason is because the hospital is full. She was there yesterday. She waited outside for about 4 hours and they couldn't help her because there was no bed available for her. And she doesn't want the same situation to happen again now because...
As I said, we're 30 to 40% down on your workforce, trying to treat double the number of patients that you would normally treat. So that strain is very difficult to deal with. I think it's a mental tiredness, it's an emotional tiredness, it's a physical tiredness. So, and I think I'm certainly trying to find the balance of how to keep going in a way that is sustainable. I think we all head out of the blocks at 100 miles an hour and then eventually you just grind to a halt.
I do blame a little bit the department because I feel they shouldn't worry about spending because nobody's life is worth any amount of money. Especially if it is us, the health professionals who are pillars of the community, you know. I feel they should go the extra mile to spend on us, to keep us safe, to have a PPE fresh every day and, you know, to just keep us safe. I do cry sometimes. I do feel anxious a little bit still. I felt very, very disappointed in my employer and, you know, we voiced it out so many times, but it falls on deaf ears.
As soon as I get enough strength, get out of the bed.
Because we are the ones who's not cooking.
Yes, yes.
When you were there in hospital.
When were they?
When you were there. Because we talk about it. You don't mind.
Yes. I thought so, my darling. That is the first thing that came to my mind. I even told my children, when I went out of this house, all my children were here. And I asked them, I said, please, my babies, pray for me because I still want to live. I said, I still want to live.
It was worse. It was very worse. I even asked myself to God, is that the last time that I saw her? Do you mean it's the last time? Because when you've got coronavirus, nobody can see you if you're dead. There will only be a box that is wrapped in plastic. It was so emotional. We were so worried.
Yeah, a lot. I mean, it's happening, it's really happening. People were not taking serious. I mean, now, because most of the people thought it's something for overseas, abroad. Now, like I say, even people close to us now, our friends, are passing on, you know. Yeah, I think people are realizing now. I mean, all the hospitals where our people go to, I mean, there is no beds. They know. I mean, you can wait there and die before even the doctor sees you. That's how serious it is.